If I were to say the word Paris, your mind would inevitably conjure the French city. Maybe you'd imagine its iconic architecture, or its influence on the arts and literature, or its cuisine. But in health policy, the word PaRIS represents something more. Something that has the potential to radically improve the health services delivered to those of us living with debilitating chronic conditions like diabetes, heart failure, and cancer. Worldwide, nearly 1 in 3 of us are affected by such lifelong diseases. How certain are we that our health services are best addressing the needs of those with chronic conditions? And how exactly will PaRIS help? This is A Treasure in Trust, a podcast about better value healthcare. I'm Dr. John McGhee, a health policy analyst, and on this show, you'll hear from the people shaking up how health and care is delivered, so patients get better outcomes and health services are affordable for this generation and the next. As you'll hear, health is truly a treasure. It's precious, be it the health of one person or of an entire nation. But this treasure is one held in trust with doctors and policymakers alike, making choices and showing stewardship of our health systems on behalf of us all. Welcome to today's episode. I'm joined today by Sara Almunif, who leads Patient-Reported Indicators Surveys, or the PaRIS project for short. Sara is based in Value in Health, a national think tank on value-based healthcare. We'll discuss what PaRIS is and how the data and insights generated by the PaRIS survey are expected to benefit people with chronic conditions all over the world. Welcome, Sara. Tell me about you and your role at Value in Health.
Sure. First of all, thank you for having me and thank you for setting this up. I'm really excited to tell people about this project. My name is Sara Almunif. I'm a public health professional. My background is in mainly public health. And I've been working at Value in Health for the past few years on various policy and knowledge products concerning value-based healthcare and global health systems. More specifically, currently, I'm working on the OECD's Patient-Reported Indicators Survey project, which we call in short as PaRIS, which is basically a project intended to measure patient-reported outcomes and experiences in the primary healthcare setting.
Tell me a little bit more about what the project is and what specifically is it aiming to achieve.
So the PaRIS project is an international benchmarking research project aiming to measure patients' reported outcomes and patient-reported experiences for patients visiting primary healthcare settings, specifically with a focus on patients with chronic diseases. It aims to improve patient-centered care and enable patients to share their experiences in primary healthcare for improvement in service delivery and health systems.
So you mentioned that this was a joint international project led by OECD. Why did OECD start the project?
The Organization for Economic Cooperation and Development, in their health ministerial meeting of 2017, the health ministers addressed that there's a crucial need to develop more health measurement tools to measure value-based healthcare and PROMs and PREMs. And that was the launch of the Patient-Reported Indicators Survey. 20 OECD member countries agreed to participate in the project and engage with each other and with external members on the implementation of the PaRIS project in their countries.
So I can't help but notice that Saudi Arabia is not an OECD country. So what was the opportunity for Saudi Arabia to join this project?
Thanks for mentioning that. So Saudi Arabia isn't an OECD country. However, at that time, Saudi Arabia was just starting their health transformation project. And there was a drastic need to measure performance and measure indicators such as including healthcare inputs and patient-centric care, and value-based healthcare was a huge element of the transformation. And actually, value-based healthcare is a pillar of the transformation. So the country saw that there was a priority and opportunity for Saudi Arabia to participate in the PaRIS project. We requested to join, and the OECD was very welcoming to put us in as a non-OECD member country participating in the PaRIS project.
So you mentioned there that Saudi Arabia had a great need to understand better the kinds of topics
covered in the PaRIS study. Could you tell me a little bit about the current situation in the kingdom in terms of these topics? So non-communicable diseases and chronic care, primary care, outcomes measurement.
One of the reasons the health transformation was initiated is to address these issues. So non-communicable diseases is a primary burden of disease in Saudi Arabia. Non-communicable diseases, there's a huge prevalence of non-communicable diseases and chronic diseases in the kingdom, especially within young adults. We're also seeing a very high trend and high number of multiple chronic diseases. Cardiovascular diseases are the main cause of death in the kingdom. And the focus of all of the reforms is on prevention and primary care and focusing more on moving towards prevention of disease. Primary healthcare, although it's very widely dispersed and accessible within the geographical regions of the kingdom, healthcare provision and patients are more relied on secondary and tertiary care, which is causing a strain on the healthcare system. That's why we need to strengthen primary healthcare. In terms of outcome measures, there have been some pilot programs implemented in various hospitals and healthcare systems since the launch of the transformation. However, they have not been implemented in all of the sectors, and the tools need to be strengthened and implemented on a wider scale, I think.
So there's some real issues around variation. So I feel there's always a risk talking about public health policy that we think about these things in the abstract. I was really interested to get your thoughts on the issues you've mentioned. How do you see those impacting on individual patients, citizens, and the clinicians who provide the services?
Yeah, so this is not intended to be a research project that gathers data and then sits on a desk. So this project is intended to change healthcare system, change how healthcare is provided in primary healthcare or for patients with chronic diseases. So patients are the primary beneficiary of care, and care is intended to be centered around patients' needs. And this project is intended to focus on what the patient wants, what the patient sees as important in their care, and for them to be more knowledgeable about their rights, about their needs, about what they require in their care. It's also an opportunity for providers and clinicians to be more aware of specific needs of certain people. So this is kind of going to be a benefit for all of the healthcare systems, patients, citizens, clinicians, and the healthcare system as a whole.
It sounds like a really ambitious program with a broad scope. What role are you playing in the PaRIS project in Saudi Arabia?
The role I'm playing is the National Project Manager, which is basically implementing the OECD policies and procedures within the national context, within the kingdom, and coordinating the efforts nationally and internationally. So we're doing the coordination with various entities within the kingdom, also communicating that progress and any issues we're having externally with the OECD and other external partners, such as data collection, data analysis, data coding. So we're managing that external relationship and external requirements within the national context and within our national data collection efforts.
Tell me a little bit about how you personally got involved in this project.
This is the first of its kind tool that's being implemented on a very wide scale in the kingdom, and it's being done for the first time. It's a huge international project. 20 other countries are participating in the project. I saw this as a great opportunity for me to engage with external stakeholders, to look at different healthcare systems and how they're improving their healthcare provision. There's also a huge gap with measurement and health system measurement, which is kind of an interest for me, health system measurement. And I really wanted to be involved in something very high scale, dealing with multiple stakeholders, and ultimately working in the benefit of patients and populations.
A challenging task, and I'm sure you're not delivering this all on your own. Who have you been working with on this project?
So this is a huge effort. We're collecting a huge amount of data nationally and looking at international partners. Other than the Center for Value in Health, that's doing all of the coordination and implementation of the survey, we do have a partner that's helping us with the data collection. We're also communicating, and one of our huge stakeholders is the Primary Healthcare Directorate at the Ministry of Health. That's helping us access primary healthcare centers and access patient and provider data. We also work with multiple private sector hospitals and other governmental sector hospitals to access their healthcare system and access their patient and provider information for data collection. We're also working with multiple entities in the kingdom that are concerned with value-based healthcare, concerned with outcome measurements, concerned with healthcare delivery, because we do intend that this information and this data, after being analyzed, be shared with them and be transformed into policy and action. Externally, we are communicating and discussing with the OECD, other consortium members. So the OECD works with Ipsos Mori, Optimedis, other entities that are helping with data analyses, helping with data coding, and so on. So we're dealing with multiple stakeholders that are interested in the project and interested in outcome measures in general. So it's a very, I would say, diverse and it's a huge team.
Wow. Yes, there really sounds like so many different people involved. Makes me wonder whether there's anyone in the kingdom who's not involved in this project. It seems huge.
As a listener to this podcast, you're no doubt like me, one of an increasing number of policymakers and practitioners concerned about making sure we get good value from the resources we invest in our health systems. There are two great places to find out more about how the promise of better value health and care is being made a reality today. Value in Health is a national independent think tank sharing insights and evidence on value-based healthcare in the Kingdom of Saudi Arabia. You can read Value in Health's policy briefs and discover its learning programs at cvalue.sa. That's cvalue.sa. Value in Health is also the host for an international knowledge-sharing entity, the Global Innovation Hub for Improving Value in Health, created by the G20. At g20hub.org, that's G20hub.org, you'll find a wealth of case studies and policy insights to support national health systems establish high-value healthcare services. Both Value in Health and the Hub's websites are updated frequently, so do check them out. Now back to today's episode.
Sarah, what progress has been made in the PaRIS project so far?
The OECD launched the project in 2019. That's when Saudi Arabia signed the agreement and decided to participate in the project. We spent a couple of years after that planning and preparing for the project, so engaging with stakeholders, translating survey materials, obtaining IRB approval, and checking if the project could be implemented in Saudi Arabia. We then moved on to the field trial, which was done in 2021 and 2022, where we collected data from a smaller sample of 1,200 patients, and that yielded great results. That helped us move on to the main survey phase of the project, which started last year in 2023. We collected data from all healthcare systems and all healthcare sectors in the kingdom, and that was a much bigger sample of 7,500 patients. We collected all of the data so far from patients and providers. We completed the data collection phase a few weeks ago, actually, so that was a huge milestone for us. However, what we noticed in the kingdom from the field trial and from the main survey phase is that most of the respondents were within the younger age group, so from ages 45 to 50. And we're also seeing a very high prevalence of chronic diseases within that age group. So we decided nationally that we would add a second phase of the project and collect data from patients 18 to 45. That's also because demographics of the kingdom are mostly geared towards younger age groups. So we decided nationally that we would add a second phase where we would measure patient-reported outcomes and patient-reported experiences for the younger age group. We plan on launching that data collection phase within the next couple of months.
I'm sure it was tricky enough to deliver the project with the original OECD scope without expanding the scope. And I'm sure it hasn't been easy delivering this project. What challenges do you feel the project has faced?
The project has been launched a few years ago. I mean, we did anticipate some of the challenges happening. However, some of the challenges arise throughout the data collection and the analyses phases. I think a main challenge was getting buy-in from leaders of organizations. However, when the benefit is explained for them and discussed with them, they automatically get more engaged and enthusiastic about the project. We've also faced challenges with timelines, with data collection methods, response rate. Those are the regular risks that are involved with any research project. However, we did manage to deal with some entities and some leaders within the system that helped us overcome the challenges.
Great. What's been your personal experience with the project?
The engagement with the project for me has been great. I've managed to engage with multiple stakeholders within the system that have input on outcome measures, on patient experience, on primary health care. So that exposure has been great for me. It's also been great hearing the input of patients, what they're really facing in primary health care and what care really means to them and how they see the optimum care they receive. So the input of patients is really valuable to me. Also translating that into policy actions and seeing changes happen in real life are really what make me going. So and the project is done for the first time. It's an international project. So you get to see how multiple countries are implementing it. So that's what gets me moving. I mean, I come in every day to the office and I'm really excited to see the results. I'm really excited to see what happened. I'm really excited to see other people's reaction to this specific issue and so on. So seeing the results, seeing the information being generated has been a really positive experience for me.
I know all kinds of things can happen on a project like this, multi-year, with so many different stakeholders and such an interesting topic. What's been the most memorable thing that's happened to you during the project?
Oh, there have been multiple great milestones in the project, but talking about this just gets me smiling. I'm going to talk specifically about one milestone that's in the back of my head. So we worked for a couple of years actually on preparing and planning for the project. A huge task we had on a country level was to translate the survey to Arabic. It's a huge survey. We have more than 120 questions, so it's very lengthy and it's very it talks about very specific products. And the task we had to translate Arabic, we are the only Arabic-speaking country. So the task to translate the survey was only on us, only on Saudi Arabia. We worked with really great translators to translate the survey to Arabic. And it went back and forth through multiple revisions with the OECD and with our translators and with our experts that had to do the cognitive testing and validation. However, we reached a consensus on the survey, on the translated survey. And that felt like a huge milestone for us because it was, it's the first tool that's being implemented in the kingdom in Arabic. And we get to use that tool for measuring patient outcomes and patient experiences within our context. So it felt like a great milestone and a great launch for the project.
You mentioned that Saudi Arabia is the only Arabic-speaking nation in the PaRIS study, and I'm sure we all know that health systems differ so much country from country. What's been different about PaRIS in Saudi Arabia compared to the experience of the other countries in the project?
This has been one of the most interesting aspects of the project, to deal with multiple health systems and looking at the context of proms and prems in different countries. Every country implements the project in the way they seem most applicable to their context. So some countries implement it in primary care. Some countries deliver primary care through community healthcare settings. Some countries only deliver primary care through family medicine clinics. So it's been interesting seeing how specific countries define primary care and how countries are implementing the survey. For us specifically, I think what was very specific about Saudi is that our age group and our population was mostly younger. The project is being implemented by the OECD from patients aged 45 and older. However, in Saudi Arabia, we saw our population is more geared towards younger age group. So we saw a concentration of patients within the younger age group. We also saw a very, very high prevalence of chronic diseases. But what was also very different is that we have different healthcare systems and different healthcare sectors. So we deliver care through the Ministry of Health, other governmental sector, hospitals, and the private sector. And that was very specific, I think, about the kingdom. Other healthcare systems have one healthcare system that governs multiple delivery outlets. We had to kind of take that further step and engage with more stakeholders for representation. We also rely more on digital tools for implementing surveys, and we have a very high digital accessibility, even with adults and older individuals. So that made it easier for us to implement the survey electronically and through the phone. Other countries did it through the mail or did it in person. So that was also very specific to Saudi. We also have a very good experience with the patient experience survey the Ministry of Health is performing. So that also helped us in gathering the data for this survey. So we collected the data more easily. It was very straightforward. Patients were much more engaged in Saudi Arabia than in other countries.
I'm sure everyone listening to this involved in the delivery of chronic disease care and primary care in Saudi Arabia are going to want to know the answer to the next question, which is what happens next?
Yeah, so that's the main task we have right now. So we already completed the data collection for the main phase of the project. The data has been shared with the OECD and members of the consortium. We're currently undergoing the data analysis phase, and we're trying to correlate the results we have with the different healthcare sectors and different healthcare delivery systems and what that means to patients. So that's the main cause why we're doing this. So we would like to understand if the healthcare patients receive truly contributes to their outcomes and truly contributes to better experience of care. So that's what we're trying to analyze and answer. We would also like to see if different healthcare systems deliver different patient experiences and different healthcare outcomes. So we're analyzing the results based on that. The OECD is also working on a flagship report where they rank countries on their performance on outcome measurements and experience measurements. So that's what we're trying to achieve within the next few months. And hopefully the results are going to yield great policy recommendations for the healthcare sector in whole and patients and beneficiaries.
You work with Value in Health, and Value in Health is the national independent think tank on value-based healthcare for Saudi Arabia. From your perspective, what does Value in Health need to do next?
I think one of the main reasons we did the PaRIS project is to implement a measurement tool that measures value-based healthcare through PROMs and PREMs. We would like to see other measurement tools being implemented and seeing that effect on the healthcare system and on patients and providers. We would also like to see other measures for healthcare systems. So we would like to analyze how our healthcare system is performing, where efficiencies and improvements can be made, have some recommendations for policymakers and health system leaders on improvement opportunities, and gear the thinking towards patient-centric care, focusing more on what that means for patients.
Are there any other ways you'd like to highlight that you think PaRIS will help bring about better value healthcare?
Yeah, so we're looking at how different healthcare systems perform. We would like to understand the relationship between the provider and the patient and what specific aspects within the provider care and provider characteristics attribute to better healthcare. We would also like to share different experiences from different countries and different healthcare systems that are performing better than others in terms of improving the healthcare they need. Some of the aspects of PaRIS change with time. So, for example, in the field trial, there were multiple questions about COVID-19. We're kind of transitioning towards thinking and gearing our thinking towards possibly other diseases or other conditions facing the country or facing the community in that time. So we would like to think out of the box and have this as a PROMS and PREMS measurement periodically and understand how this can improve patient care.
Clearly, there will be a huge range of insights coming from the results of PaRIS. Who should be interested in finding out more about the results?
Everyone, John. So everyone should be interested in PaRIS. This project is producing a huge amount of information. We're trying to analyze the results based on interest. So we're gearing our thinking towards policymakers, towards providers, and also specifically organizations. So we're gearing the thinking towards patient care organizations, towards private care organizations, towards pharmaceutical companies, toward hospitals and primary care centers. So we're trying to cater the results based on organizations. Patients are the primary beneficiary of the survey because it's going to help enhance provider-patient communication, and patients and the citizens should be really interested in the project. This is going to help them communicate what interests they would like to be, what interests they have, what is important to them. So citizens and patients and residents of the kingdom should be really interested in the results and implementing the project. I also think the international community can learn a lot from our experience. We do have really positive experience in the PaRIS project and in various PROMS and PREMS and value-based healthcare measurement projects. So I think the international community would be very interested in understanding the results of PaRIS and possibly implementing the survey in their context.
As someone from the international community or a policymaker in Saudi Arabia or a citizen or someone like me who's just fascinated by health systems, how can we find out more?
So we have our website. It has all of the information about PaRIS that's publicly available. We also intend on sharing a few academic papers that are concerned with the results of the field trial and the survey itself. That's planned for publication within the next couple of months. We also periodically share the results of the PaRIS survey, and we intend on sharing that with the general community on our website, on our social media account, within academic journals, and so on.
Thank you, Sara, for taking us through the ins and outs of the PaRIS study. I know you're working on a range of other things. Would you like to tell our listeners the things you're working on now?
Sure. So we are working on our defining a measurement framework for Saudi Arabia. That's one of our aims. We're also working with, we also just established the Value Network, which is a network of a few stakeholders and a few leaders within the healthcare field that are concerned with value-based healthcare. And we intend on sharing best practices and getting the discussion heated towards value-based healthcare. We're working on other policy products that are concerning value-based healthcare and publishing that out for the system to get the benefit from and try to implement that within their specific contexts.
Great. Thank you, Sara. One last question that we like to ask all of our guests on this podcast. I'll ask to you now. So what's the one thing you think health systems should do to bring about better value healthcare?
I think healthcare systems should look at the patient perspective. Just asking a patient or even looking at your personal experience visiting a healthcare provider or a hospital or a clinic, you look at different aspects. And I think improving the patient experience and looking at the patient perspective of care would go a long way. We see multiple initiatives happening that try to improve quality, improve patient care, improve mortality rates, improve infection rates, improve hospital admission time, and so on. However, I think the initiatives need to gear more up towards the patient experience. But also, I think looking at the patient perspective and what care means to them and how that is attributed to their clinical outcomes would go a long way.
Thank you very much indeed for coming on the podcast.
Thank you, John. It's been great talking to you and talking to our audience. You can reach out to me through email and through social media accounts if you would like more information about the PaRIS project, and looking forward to sharing the results with everyone.
Now, if you hear the word Paris, don't just think of France's capital, the City of Light. Think also of the PaRIS project, an international initiative that will shed light on how we treat people managing chronic conditions. Many thanks to my guest today, Sara Almunif from Value in Health, and thank you for listening. I'm John McGhee. Stay well, and together, let's make healthcare better.